Good Thursday afternoon. I'm Katherine Killen, Chief Strategy Officer for the Knox County Health Department. Our moment of gratitude today is dedicated to the delivery men and women who are working so diligently to get COVID-19 vaccine distributed across our country. We are encouraged by the news of some local hospitals in our region receiving the vaccine as early as today, and look forward to hearing about frontline local healthcare workers getting the protection from the vaccine that they so greatly deserve. Once again, I want to take this opportunity to stress how encouraged we are by the news from the scientific community illustrating the safety and effectiveness of this vaccine. Getting the vaccine is a personal decision for you and your family. And as you make that decision, we urge you to seek out information from trusted sources. There is an overwhelming amount of misinformation on the internet and in social media about the COVID-19 vaccine. So we urge you, please make sure you are getting your information from reliable, credible sources so you can make the best decision that you can for you and your family. Those sources include the Tennessee Department of Health, the CDC, the Knox County Health Department, and of course, your medical provider. Before I move into the benchmarks, I want to spend a few minutes talking about our local situation. As we've done previously, we want to show you a visual representation of how the holidays impact our local situation. As you can see, after each holiday this year, we have experienced a surge of new cases. Over several weeks, that number starts to level off. Take a look at Thanksgiving. In the past week, we have seen record high cases. These numbers are not heading in the right direction. And as we well know, hospitalizations lag behind new cases, and sadly, deaths lag behind hospitalizations. With Christmas next week, there is not enough time for our caseload to level off before we could experience another surge on top of what we are already seeing. To really illustrate this, I want to share some information that we provided at last night's Board of Health meeting. As a note, this data was pulled yesterday, so the following items are from December 1st through December 16th. So in those past 16 days, 51 individuals have lost their battle with COVID-19. That's more than 20% of all deaths reported. More than 25% of all cases reported to Kchd, to the health department, over the pandemic have been reported in that time frame. Since December began, an average of 3.4 individuals have died every day from COVID-19 in Knox County. And in the same time period, an average of nearly 400 cases have been reported every day. We can't change what happened over Thanksgiving, but we can change what happens over Christmas. We are urging you to celebrate the holidays with your household, as that is the lowest risk activity. However, if you are going to keep your plans of celebrating with those outside your household, please be diligent about practicing the 5 core actions. Wear a mask when you are indoors or not appropriately distanced. Always keep at least 6 feet of distance between you and those outside your household, regardless of whether you're wearing a mask. And please stay home if you're not feeling well. Even if it just feels like the sniffles, please stay home. We can't stress this enough. You have the power to impact your community. Please take a moment today and consider how you can shift your holiday plans to protect yourself, your family, and your entire community. Now we'll move into the local situation. We have 527 new confirmed cases since yesterday's report. 4,562 are active cases. 127 Knox County residents are currently hospitalized. And sadly, we have 3 additional deaths to report today, raising our total to 237. Now we'll move into the benchmarks. All of the data that we are about to review is available on our website at covid.knoxcountytn.gov. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. Over this time period, we once again hit a new record high case volume, with the average number of cases per day trending up. Because of these factors, we are continuing to represent this benchmark as red. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we are utilizing two bar graphs, one that shows a sample of the tests conducted for Knox County residents, and another for the average time between specimen collection and lab report data. Regarding testing, the local number of tests conducted has increased over recent weeks. However, the issue we are continuing to see is with lab turnaround time. Over this time period, we are seeing an average turnaround time of 6 days in our community. Because of that, we are continuing to represent this benchmark as red. Our third benchmark, sustained or increased public health capability. Of the cases that fall within the new prioritization structure, the goal remains to initiate investigations for new cases within 24 hours of us receiving notification, and close contact investigations within 48 hours of notification. Based on our internal assessment of our capabilities and acknowledging the need to prioritize our case investigations and contact tracing, we are representing this benchmark as red. We want to remind everyone to take personal responsibility and quarantine themselves at the first sign of exposure. Do not wait to receive a call from public health to start taking action. Isolate yourself if you have symptoms or have been exposed, and start calling your close contacts to make them aware so they can begin quarantining. Additionally, if you have been tested, regardless of whether or not you have symptoms, you need to quarantine until you get your results. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System. It may reflect Knox County, the East Region, or patients from other jurisdictions. During this time period, flags were noted for positive inpatients, ICU patients, and ventilated patients. After speaking with our hospital partners, they have recommended that the benchmark be represented as red. As always, the hospital systems continue to meet routinely, work together to ensure that no system is impacted disproportionately, and plan their response together to best serve this community. The decisions regarding how to classify this benchmark are made in concert with our hospital partners, as well as taking all of the data into consideration. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we use a graph that shows the reported deaths of Knox County residents by date of death. Deaths have continued to increase in our community. During this time period, we have seen 19 deaths related to COVID-19 over 7 days and 38 deaths over 14 days. The information available leads us to represent this benchmark as red. Under our supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of Tuesday, our 14-day trend line shows 82 new cases per 100,000, and our 7-day trend line shows 97 new cases per 100,000, both of which are up from last week. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health. The 7-day average for percent positive in Knox County is 21.75%. And now I'll open it up for questions.
All right, as a reminder, please go ahead and submit your questions into the chat feature. The first question we have is from Jeff with WATE. We've seen a single box come into UT Medical Center, and we're expecting at least one more box at another hospital this afternoon, I believe referencing vaccine. How much more can we expect to get in Knox County in the next few days before the Moderna vaccine starts coming through?
I think that's a great question, and I think that's one that's probably directed best right now at our hospitals as they are receiving this first initial batch. But we are expecting Moderna early next week. We don't have an ETA yet, but as soon as we have that vaccine, as we have stated, in hand, we will let you know how much we got and can confirm that information then.
All right, any further questions? Please go ahead and submit them now. Also from Jeff with WATE, you mentioned the 3 deaths per day average. How does that compare to a non-COVID year?
Well, I think one of the important things to think about when we talk about COVID-19 deaths, aside from the fact that these are families and friends that live in our very community, and so talking about them in numbers is always difficult. But deaths from COVID are new and above what we would normally see from other deaths this time of year. And so I think it's important to remember that these people would still be with us had they not contracted COVID-19.
From Vincent with the Sentinel, he'd like you to spell your name and provide your title one more time.
Sure, it's Catherine Killen, Katharine, Killen, Killen, and I'm the Chief Strategy Officer for the Health Department.
From Jeff with WATE, how is Dr. Buchanan doing? Has her illness and isolation caused any ripple effects to KCHD operations, and how many other staff were affected?
That's a great question. So first of all, thank you for asking that. She's doing well. We have been on Zoom calls with her this morning, and she's continuing to isolate at home. As we stated in the news release last week, there are no other close contacts at the health department. We do our very best to take our own advice, which means she had no contacts from KCHD staff. So it has not affected operations. One thing I do want to talk about a little bit is the importance of the 5 core actions. We've seen some comments about this from people once they heard of her illness. And I do want to thank the many people who have reached out to us and to her, wishing her well. So thank you very much for that. Regarding the 5 core actions, I'm not going to speak specifically to her situation. I don't have details on that, and I don't need those details because it's an individual case. But what I can tell you is the evidence supports the 5 core actions. And we know that doing these things together, especially, dramatically reduces our risk of getting COVID-19. I would compare it to a seatbelt. You know, there is no guarantee that by wearing a seatbelt that I'm not going to get hurt or worse in a car accident. But you better believe I put one on every single time I get in the car.
From Brian Hornback, in regards to the safer at home guidelines, the expectation is not only Christmas, but New Year's, where people are expected to celebrate at home, correct?
Correct. And so I think the resolution that the board passed last night illustrates the importance of the best and safest place for all of us is at home. And as much as you can adhere to that, the better.
From Claire with WUOT, has the health department received the White House task force report for this week? If not, why do you think you haven't gotten a copy yet from the Tennessee Department of Health?
Yes, I believe we got that either last night or this morning. Yes, so we have that report.
Yes, Claire, that came into us this morning, so we have received it. From Jeff with WATE, do you have any new guidance about potential allergic reactions to the vaccine?
No, I don't think we have any new guidance regarding that. One thing I think that's really, really important to underscore, and our medical professionals yesterday on a legislative call talked about this. Every single medical intervention available, so that means treatment, medication, vaccine, comes with physicians learning and studying risk evaluation. And so your provider decides that any risk from that medical intervention, treatment, medicine, what have you, vaccine, is outweighed by the potential benefit. And so when you're considering vaccines and what to do is right for your family, talk to your medical provider. But remember that when we hear about these side effects, at least the initial ones that we're hearing about, they are, I think, expected that you would hear from some vaccines and some medications because that usually comes with that and it's mild. But we will know more about each additional vaccine as the FDA provides their EUA, as well as when ACIP, the advisory, I think it's Council on Immunization Practices, provides their review and additional information. And from then, when we have that information, we can provide that to the public so they can make the most informed choice for them.
From Brian Hornback, with the restaurant closures at 10 p.m., there will be no restaurants open in Knox County at midnight on 1/1/2021. I think there was supposed to be a question mark there, so I think it was asking, will there be?
No, and I'd have to go back and look and see when that, so yeah, it was extended through January 6th, I believe. So that is correct.
From Jeff with WATE, can you walk us through KCHD's steps once the Moderna vaccine arrives? Whom will you contact? And will you bring the shots to recipients or will they have to come in? And other questions were, is your priority list already set and how specific is it?
So yeah, so our priority list is set in the Tennessee Department of Health plan. That includes those who provide mass COVID-19 testing events, to school health, to the homes for the intellectually and developmentally disabled, as well as first responders. So our staff, and I want to just, if I can, take a moment to thank them. Our staff who have been providing COVID-19 testing and who are now going to be providing vaccination are remarkable and incredibly flexible. For testing as an example alone, to illustrate this point of what they can do for a vaccine, they have stood up mass vaccination or mass testing here at our facility. They have streamlined and reviewed and changed their process. They worked with multiple different labs to make the best possible user experience for the people who come here. They've gone out and done events in the public to test. And so it's that same practicality, that same level of experience, and that same level of organized flexibility that will help them as we move through vaccination. So based on what we get next week, we will take the amount that we get and we will take the plans and the guidance from the Tennessee Department of Health to vaccinate those groups. It depends on how much we get and a few other factors as far as when and next week, but we are coordinating actively with those groups now to figure out how best to do that. We don't expect right now that we would get enough Moderna vaccine next week to be able to fully immunize everyone within each of those categories that I've mentioned. So I think that's important. It'll take time.
And then Jeff was following up on the specificity question. Do the people who are slated to get the vaccine on day one know that they're on the list at this point? And can we meet one of them?
I think that's a great question for them. I hope so. We've been working closely with different groups and trying to get that information out. And we will continue to do that today, tomorrow, and especially once we get the vaccine next week.
All right, any further questions, please go ahead and submit them now. All right, I'm not seeing any further questions being typed into the chat feature, so thank you all for your time today. We will see you again on Tuesday of next week, and we hope you have a safe and healthy weekend.